UKR, as we all know, is unicondylar knee replacement. This is also called as partial knee replacement surgery, but I would like to call it as a partial knee resurfacing surgery. The concept and the idea behind it is basically we are trying to preserve and do as minimum a surgery as possible so that maximum of the joint, which is natural, God given, is preserved and only the affected part of the knee is replaced. The idea behind it is basically we want the natural God given knee to last as many years as possible until we do a total knee replacement. By that, it does not mean that partial knee replacement is a half surgery or not a good surgery. It itself is a complete treatment for the patients who come with a component called as a medial compartment osteoarthritis. Here basically only one part of the knee is getting affected, the rest of the knee is not getting affected. These patients are treated with a total knee replacement. Is basically you are replacing all four tires of your car when only one is worn out. So the idea is simple: if only one tire of the car is worn out, so we replace only one car and no need to replace the whole car or all four tires of the car. Okay, so this is the concept behind the partial knee replacement. So there are many benefits of partial knee replacement or a unicondylar knee replacement. Here it's a minimally invasive surgery, so the blood loss is less, the pain after the surgery is minimum. Here we are preserving 5 out of the 6 ligaments in the knee. So what it does is the balancing and walking after the surgery is very easy and pain free. Patient gets maximum function and the feel of a almost or a natural knee. Here the patient will always say, I feel like my knee is normal and natural. So, and this result is not a temporary result. It can easily last you for 10 to 15 years, and it's not a temporary treatment. It's definitely an alternative to total knee replacement in patients with only one compartment of the knee which is affected.